Well, May is Stroke Awareness Month, and they can happen to anyone, even if you're younger. Globally, about 1 in 4 adults over the age of 25 will have a stroke in their lifetime. Here to talk about it is Dr. Antonio Moya, a neurologist and volunteer with the American Stroke Association, and Cindy Shea, who is actually a stroke survivor. I want to welcome you both.
Thank you.
Now, for people that don't know, can you tell us a little bit about what a stroke actually is, and are there different types?
Yeah, sure. So stroke is a brain attack. It's a disease of the brain in which the brain does not get enough blood. And that can happen in several ways. So an ischemic stroke is when a blood clot stops blood flow to the brain, and that can cause death of these brain cells. And then there's a hemorrhagic stroke in which there's bleeding of the brain.
Wow. Okay. Wow. I didn't realize that there were so many. And Cindy, you had a stroke just a few months ago, right? It hasn't even been a year.
No,
Tell us what happened.
I'm actually a performer. I'm the founder and trumpet player of Mariachi Divas. So we perform pretty much daily throughout the year. And I had just finished a concert, and I was about 30 minutes out from that concert, and I got the most extreme headache you could ever imagine. I didn't know in the moment that it's called a thunderclap headache. These are all things I learned later after finding out I had a stroke. But it was the worst headache you could ever imagine, and that was my first sign that something was wrong.
Wow. And you're doing well now. You just went for treatment? I mean, did someone immediately know that you were having a stroke?
I was with one other person, and I knew something was terribly wrong when I lost my hearing on my left side also. And then I just got nauseated and started vomiting, and I knew right then I needed to go to the ER, and I'm the one who said, take me to the ER. If I wasn't with someone, I would have called 911. Luckily, I was still aware for a good few minutes that I was able to still text. I know I texted my son, and I said, Mom's not coming home. I'm going to the hospital. So I was able to do that. And I know that the doctors all told me if I hadn't got to the hospital when I did, I probably wouldn't have lived. I've got the word miracle told to me several times in the ICU, because that's where I landed after getting all the testing done. And I didn't even know I had a stroke till probably 2 or 3 days after I was in the ICU, or understand what that had meant. I literally sat and educated myself in the ICU, and that's why I feel this is so important to have more education on what types of strokes there are and the signs to look out for, because a lot of people think you just lose feeling and that's a sign of a stroke, and there's so much more, like the thunderclap headache, which is what it's called.
And doctor, tell us a little bit more about the importance of getting treatment right away and for people to know that you're actually having a stroke.
Sure, so it's very important to go to the emergency department as soon as possible by calling 911. By going to the emergency hospital and getting treatment, you potentially decrease your disability and potentially death from that stroke. And so what we always tell people in the community is easy way to remember a stroke symptoms is the acronym FAST, F-A-S-T. So F stands for sudden onset of face weakness or numbness. A stands for sudden onset of weakness or numbness in the arm, or it could be the leg as well. S stands for speech. So if a patient has any slurring of speech or even difficulty understanding language, that could be a stroke as well. And then T stands for time to call 911, because again, stroke or brain attack is an emergency.
And are there certain risk factors that we need to be aware of?
Yes, there are. So high blood pressure or hypertension is one of the primary risk factors for stroke. Oftentimes we call it a silent killer because people don't know that they actually have high blood pressure. So you need to know about that. Having high cholesterol, high blood sugar is also a risk factor for stroke. And then smoking or vaping is also a risk factor for stroke. If you do have an irregular heartbeat, specifically what we call atrial fibrillation, that could cause more blood clotting in the heart, which could then cause a stroke.
And Cindy, how are you doing now?
I'm doing amazing, wonderful, and I feel so good that I'm able to give the message to try to prevent, get the high blood pressure down, test yourself, have, you test every day for your blood pressure, your blood sugar, eat right, sleep right. Those are all the things that I was lacking, and I believe high stress and blood pressure is what caused my stroke, just because of the high intensity life I live and not sleeping right. And I think that people congratulate you for that growing up. Oh, great, you're #1. You got, the best award and the best grades, but you don't sleep for a week studying for your exams. And I think people forget that we have to remind the kids growing up, because that's where your education starts, that sleep is just as important as, to succeed.
Yes.
And eating right. And now I'm delegating more. I'm not trying to do everything myself. So those are all the things that caused my stroke, and everyone is different. I didn't have any of the arm problem or any of those, so it's important to know that there are different symptoms like the thunderclap headache. And call 911. If I see a lot of people that, you know, say, oh, it's just a headache, I'll just go to sleep, I'll just rest, I'll feel better later, I'll take Tylenol, or I'll take ibuprofen. You don't know if you're doing more damage by taking a blood thinner that could be making your situation worse. And now I can't take certain medications because of that. So the best thing to do is just call 911 and let them handle it.
Absolutely. Well, we're glad you're doing well. Thank you both for joining us. And of course, you can find more information about the American Stroke Association by going to our website, kcalnews.com, and click Seen on TV.